Bonjour à toutes et à tous.
Hello, everyone, and welcome to this 16th CHAM convention, which is under the theme Rethinking the Healthcare Professions. So, this is a very broad topic, dear friends. This convention should be an urgent call to imagination as well as action to rethink our healthcare system based on the different professions that are shaken up by the masterful advances of the artificial intelligence through its information and robotic technologies, as well as by the startling progress of biogenomics. This is a pivotal moment in the history of humanity and medicine in particular, where the boundaries between science fiction and reality are blurring. Will the clinicians of the future be digital doctors available day and night on our smartphones, tell me Google Artificial Intelligence Explorer for medicine? Or will they become experts in precision medicine or architects of population health, integrating massive data to personalize, customize every stage of our care? In this new digitalized world, will the general practitioner disappear or will they become prime contractors managing patient data and coordinating the other professionals and the local healthcare team, because I think that probably they should be at the very top of the hierarchy tomorrow. Will the same professionals increasingly intervene to treat common pathologies themselves, breaking with the sacrosanct diagnostic and therapeutic approach hitherto reserved to medical doctors alone? Will medical specialists find themselves more exposed than others to the power of an AI capable of stealing much, if not all, of their work? Will the patients become the CEO of their own physical and mental health when it comes to ultra customized treatment decisions and transparency or results and costs? These are just some of the questions that need to be answered if we are to build a healthcare system which is fit for its century. At the same time as the development of the cutting-edge digital technologies is threatening to wipe out whole areas of current medical activities, local professions will be increasingly in demand in companies, administrations, sport facilities, but above all, in the homes, on the farm, in apartment, in elderly care centers, and in the street. Care will go beyond the walls of hospitals, clinics, and doctor surgeries, expanding into homes and communities thanks to easier access. Nurses and their colleagues in advanced practice will become the heroes of this transformation, providing customized care as well as monitoring serious and chronic pathologies as close as possible to patients in their personal environment. As for its part, telemedicine, so often denigrated without reason, will be getting closer and closer, and will be getting patients and professionals closer together as well as professionals between themselves, opening up new channels of exchange that respond quickly and humanly to the daily needs of the patients. Researchers and product developers in the medical device and drug industries are designing already new instruments and molecules using computers on virtual patients with the aim of increasing our physical and cognitive performance and reducing the aging process. Unfortunately, these technological and organizational advances have their downside, exposing us to major risks. What will remain of medical confidentiality in the increasingly shuffling of all the patient data? What will happen in the event of massive computer breakdown? And finally, will hacking become a daily plague for healthcare establishments, caregivers, and patients harassed by digital crooks who charge them a hefty ransom? Prior to treatment, another major health challenge awaits us: the prevention of the ills that beset us. Primary prevention is not the direct responsibility of medicine, but of the society as a whole, by practicing a healthier lifestyle learned at school in terms of diet, physical activity, mental well-being, safety at work, the fight against addictions and various forms of pollution, and the elderly detection of personal genetic risks. To support these transformations, we need to redefine the training of healthcare professionals using simulation and digital immersion as part of a shorter curricula, incorporating the latest scientific and technological advances, as well as training in the art of listening and caring, first and foremost. Last but not least, the assessment of professional practices will also have to be completely rethought, both in terms of its modalities, but also its frequency. At least once a year, each professional will be required to assess the results of his or her actions against a national average, which does not exist today. At a crucial time for our public finances, how can we accept continuing to pay blindly for a considerable number of unnecessary procedures prescribed and carried out, generating billions of euros of pure waste? As the saying goes, there is a lot of work to be done, a lot of work. Fear of change, exacerbated by the prevailing corporatism, is holding back the rapid development of the essential transformation we need to undertake. We all complain about everything without wanting to change anything. So to succeed, there is only one word to always keep in mind: freedom. The freedom to act, allowing professionals to organize themselves according to various modes of action in unprecedented cooperative ventures, territory by territory, far from the innumerable decrees, orders, circulars, and other sometimes contradictory standards that pile up in the official journal. Freedom based on trust in the ability of players to work together in multi-professional communities. Then, and only then, will thousands of oases of health flourish in the midst of medical deserts. Let's dare to push back the frontiers of the imaginable by driving forward a genuine policy of health and physical, mental, and social well-being accessible to everyone without ever abandoning the oldest, the weakest, the most deprived, and the loneliest among us. I also wanted to inform you that after 16 years of our service here in CHAM, that has also joined Europa Group, that is funded and presided by Marco Dancieux, with whom I share a lot of values, I will also give this task to everyone, to them, by also wishing the immortality and the continuity to all this great work and all this great team. And now I would like to welcome Fabien Brizard, who is the Managing Director of the Circle of Research and Analysis, CRAPS, to take over from me in presenting the debates. Thank you very much.
Merci. Bonjour à tous. Merci.
Hello, everyone. Thank you very much. Hello, everyone.
On est tous ensemble.
We are all together. Yes. Thank you. Thank you. Thank you so much. Thanks to all of you. Thank you so much.